Hi, it's Dr. Christi, board certified urologist and urogynecologist. And today I want to give you 5 tips of what you can do to improve your recovery after a bladder lift, specifically a robotic bladder lift. This is a surgery that I do almost every week. This week I happen to have 5 robotic bladder lifts. I did 2 today. It is the gold standard repair for a bladder lift if you have a prolapsed bladder. And it's a great surgery. We can do it as an outpatient with minimal invasion, no big cuts on the abdomen. You don't even have to stay in the hospital overnight. It's a very easy to recover from, and I highly recommend it to my patients. Very high success rate, very low risk in the hands of an experienced surgeon. So patients always ask me, what do I need to do to recover? And so I'm gonna give you 5 tips of what you can do to recover more quickly from robotic bladder lift. Okay, number 1 is to get up and start moving as soon as possible. So as soon as you're cleared to go home and you get home, you can walk around your house. And, of course, with caution as you're waking up from anesthesia. Hopefully by the time you get home, you're pretty awake. But as soon as you're feeling pretty good and you've got somebody there to kind of keep an eye on you that first day, go ahead and walk around. Do a few laps around your house. You are allowed to go up and down stairs slowly. You're not going to be bounding up and down stairs, obviously, but up and down stairs slowly and walking around. That movement is going to get your bowels moving. It's going to mobilize the gas that we use to inflate the abdomen. It's going to get that mobilized more quickly, and it's going to help your lungs to expand better. Tip number 2, take deep breaths. So deep breathing is going to help expand your lungs. Typically after a big surgery, and if a patient's in the hospital, we'll give them what's called an incentive spirometer, which is a little plastic device that encourages you to take a big deep breath and reinflate your lungs, open up all the little air pockets in your lungs that may have gotten a little inflamed from the anesthesia, from the intubation during the surgery, the pressure on the lungs during the surgery. So big deep breaths, that's going to help you recover more quickly. It's going to provide oxygen to your cells. It's going to open up your lungs and prevent pneumonia. Number 3, stay hydrated. Drink plenty of water. Water is going to be your friend. It's going to help you recover more quickly from surgery. If you don't really love water, anything that you can drink with electrolytes, some lemonade would be great. Gatorade, Pedialyte, anything like that is going to be really good for you. Staying hydrated is really important. I also recommend IV nutrition therapy to my patients where they can come in and get a vitamin IV infusion. If your doctor doesn't offer that, then you can find an IV drip spa infusion area where they can give you a cocktail of several high-dose vitamins that are going to help your body to recover more quickly. And then the hydration, getting that infusion of fluids is going to be very healthy for you, provided that you don't have any heart condition that would make you require to be careful with fluids, or a kidney condition that would require that. So if you have any questions, check with your physician first before doing that. But that's been really helpful for patients. They bounce back much more quickly from the surgery. Tip number 4 is to be aggressive with treating constipation. Constipation is very common after this surgery. So I tell my patients to get some Miralax, get stool softeners, and get started right away on the measures to prevent constipation, because it'll catch up with you if you don't catch up to it first and be aggressive with it first. So go ahead and start those right away after surgery, and you'll maybe you might get a little bit loose, and then you can back off from those. Some people go on for several weeks and even a couple months that they have constipation. So the more you can hit it from the beginning, the better off that you're going to be. And number 5 is to be patient with yourself. A lot of patients don't really have that much pain. I give my patients a light narcotic to take home, but a lot of people just use Tylenol or ibuprofen because the pain is not too severe. And so you can take those, but your body needs time to heal. You need to let your body heal. This is reconstructive surgery. So you need to let everything go back to where the surgeon put it. And don't lift anything more than 10 pounds for a few weeks. Take it easy. Keep walking. Keep moving. Don't be a slug. Don't sit around stagnant and gain 10 pounds. Keep moving, but be patient with your body. Give yourself time to heal. Be patient with the process. It may take a while for function to catch up to the form. So everything's put back in position. Your body has to catch up to the new positioning and learn how to work properly again. So those are 5 tips of how you can rock your bladder lift and do great. If you're in the Houston area, I would love to see you and consult with you and see if you're a candidate for a bladder lift, a robotic bladder lift. It's one of my favorite surgeries to do, and we have great results. So check us out, LifeSculpt MD. If you like the content on my channel, please subscribe, give me a thumbs up, and comment if this helps you, if this leads to any further questions. I'll do my best to answer them. Have a great day.